Thank you so much. Right now on Friends at 5, we are digging into President Trump's One Big Beautiful Bill. Pediatrician and spokesperson for the American Academy of Pediatrics, Dr. Deborah Greenhouse, is beside me. Now, me and you had the chance to talk. Tell me, what are your concerns when it comes to healthcare access here in South Carolina?
So healthcare access in South Carolina is heavily dependent upon Medicaid. 53% of all children in South Carolina are covered by Medicaid. It's their lifeline for healthcare access. Over 60% of children in South Carolina with special health care needs are covered by Medicaid. These catastrophic Medicaid cuts in the Big Beautiful Bill will cause many of those children to lose their health care access. It will also cause immense problems for their families. Those are the direct problems: children losing health care, some adults with medical problems losing health care. The indirect results, which will happen quickly, is that the Medicaid dollars coming into the state, as they decrease, our rural hospitals will suffer. We'll see rural hospitals closing. We will potentially see children's hospitals suffering, potentially closing. Then it doesn't matter. The indirect results of this are that everyone suffers. It doesn't matter if you have Medicaid or if you have Blue Cross Blue Shield insurance when your hospital is gone. When that rural hospital closes, no one has access to care in that area regardless of their insurance coverage. So these catastrophic cuts impact everyone in South Carolina, not just people with Medicaid.
Okay, so earlier today, in response to the passage of President Trump's Big Beautiful Bill Act, our Senator Lindsey Graham wrote in part, and I'm quoting here, "My Republican colleagues did a great job of clinching a big win for President Trump and the American people." He also said during another interview today, "We achieved cost-cutting savings, the largest in the history of the country." So when you hear that, what goes through your mind?
He's not right. The reason for that is that you don't save money by cutting people's access to health care. The child that I saw in my office today with asthma, who I put on a maintenance regimen of medications to prevent flares, to prevent them from ending up in the emergency room and in the hospital, if that child loses his Medicaid, he can't come to me anymore. He's going to end up waiting. He'll get sicker. He'll be in the emergency room. He'll be in the hospital. That visit that might have cost $100 in my office suddenly becomes a $50,000 hospital stay over and over and over again because people have lost care. And that's not just asthma. It's diabetes. It's seizure disorders. It's children with attention deficit disorder. It's children with special needs, with autism, with developmental delays. All of those children now can't get the care that they need. And they wait, get sicker, they're in the hospital.
I want to ask you, Dr. Greenhouse, real quick, for families who are watching this, what can they do in response? Can they take any action right now? Should they be calling, getting a visit right now?
Well, certainly if their children have special needs, they want to make sure that they are shoring up everything that they need to have in place right now. But what I would say, what everyone can do right now, the Senate passed this bill today. We can still work to see if we can't make changes before this bill manages to pass the House. It doesn't get to the President's desk until it passes the House. Mm-hmm. So we need to make sure that everyone understands just how catastrophic this is, just what impact it's going to have on children with Medicaid and on children and families without Medicaid. This is not a big beautiful bill. This is a big catastrophic bill for children and families. And if people understand that, then they can reach out to their House representatives and they can ask for folks to, hey, please look into this. Please stop and think what the impact of this bill will be down the road. Not what the impact of this bill is on paper today, but what is it really going to do to people? Mm-hmm. That's what we need to be looking at.
Well, Dr. Greenhouse, thank you so much for sharing your perspective. We are staying on top of this story, and we're going to have more updates to come on News 19 at 6 o'clock. Stay with us, though, more right here on